I drive through the neighborhood actually every morning on my way in. There's still a tremendous amount of blight in the community.
Ann Robinson Lindsay thinks blight is evident in more than just the landscape. Blight touches the health and well-being of those living in the university area community.
The residents in this community are low-income residents, and a lot of them are undocumented aliens and needed to be able to have access to health care.
With knowledge of the area, 4 medical students from the University of South Florida set out to make a difference. These students, Sam Crane, Waldo Guerrero, Omar Hamad, and Shelby Kent, sought and gained administrative approval to start USF Health's first student-run free clinic.
We realized that there was a great need within our own community here at the College of Medicine, and we wanted to start a student-run free clinic.
The name of our clinic is Bridge. Bridge stands for Building Relationships and Initiatives Dedicated to Gaining Equality.
Students run the clinic, they do all the lab work, they do all the data analysis. The only aspect that is physician-run is overseeing the patient.
I'm excited. This is a wonderful thing. You know, I never would have envisioned starting a clinic while I was in medical school.
We hope that people will come and see us as their doctor, the doctor that they're going to come to manage their health needs.
Bridge offers free health care for uninsured adults living in the university area community, which borders USF. Unlike most clinics, volunteers from Bridge recruit their own patients. At this free health fair, medical students provide education and screen for cholesterol and high blood pressure. Financially eligible adults are then referred to Bridge for further care. Bridge is housed within the University Area Community Health Center, so in a sense, patients have their own neighborhood clinic. The Hillsborough County Department of Health offers for free its tools and space to USF Health volunteers. Dr. Doug Holt is the county health officer.
What we're about is influencing people to make choices and behaviors and to do things that that they have to believe is in their best interest, and coming from somebody who cares about them, knows them, and is respectful of them. And that's what without cultural competence, you can't do that. The cultural competency starts with, you know, how you say hello, and what are the forms you're using, and how you interact with people, the process by which you handle your system.
Theodosia Cunningham is here for a follow-up visit. So far, she's received free prescriptions for her high blood pressure and free lab tests for her pain. When she enters the clinic, she's greeted by a patient coordinator.
They even know me when I come in here. I know you know. And they're fantastic people, and they really act like professionals. It's fantastic. Believe me, it's fantastic, and they're wonderful girls and everything.
Cultural competence is evident to speakers of both English and Spanish. Maria Lopez relies on a student translator to relate the treatment for high cholesterol.
Entonces hay que dar muchas indicaciones a uno muy buenas para conservarse más o menos saludable.
Maria says the doctors are good at telling her about proper nutrition and exercise. During one visit, Maria will have access to student doctors, physical therapists, and social workers. The students are supervised by licensed professionals who volunteer to serve as mentors. Bridge is one of a few student-run clinics in the U.S. that brings together students from several health professions in one setting. Jose Romero came to the clinic with his wife and 2 children. As a construction worker, Jose's livelihood is based on his health.
Because you're all the time in your knees, doing with the tools all the time, you put the tile again and again and again. You only get breaks like 15 minutes and 20 minutes, that's it.
This is how integration works at the clinic. A medical student checks the patient's vitals. Then a team comprised of 2 medical students and a social worker collaborate to take the patient history and perform a physical exam. Then the students present the information to their respective licensed practitioners while PT interacts with the patient. USF Health student Andrea Perlak is the PT director.
PT is very important because from what we've learned about the community is that a lot of the community members have jobs that involve a lot of manual labor, a lot of types of situations that are taxing on the musculoskeletal system.
Andrea believes this integrative approach to healthcare makes a difference for patients and students alike.
It's a great way to practice for the real world, talk to physicians and medical students, and kind of spearhead a new approach, and I think a better approach to medicine, which is a collaborative approach.
Melanie Present, a USF Health student, is the clinic coordinator for social work. During her visit with patients, she listens to their concerns, makes sure they understand their treatment options, and links them to financial and social services. She recalls a patient who left a lasting memory on her.
And she just spent a lot of time talking about how she's really thankful about the services, and she really enjoyed coming to Bridge, so that made me feel really good, so I connected with her.
And Melanie encourages other students to volunteer at the clinic to help make a difference and to learn from other USF Health students.
I think that each discipline learned a lot from all the other disciplines. I learned so much about medicine. I learned medical terminology. I learned kind of the flow of, a medical setting.
Bridge survives on the goodwill of people from within the community. Volunteers include students from USF Health and their mentors from the university and throughout the community. Mentors who volunteer at Bridge tell us they're invigorated by their interaction with students and are reminded why they went into healthcare in the first place.
The opening of the health clinic actually does a lot to improve the quality of life for these residents.
And one appointment helps everything. First the doctor, then physical therapy, then the social worker.
Everybody here is nice. Everybody here is nice and they're helpful. Everybody else is grateful because I see a lot of people coming here all the time. So it's just fantastic. And I hope they keep it up and have something like this all the time for people like us.
The Bridge Healthcare Clinic, making a difference in the university area community.